In this video, we're going to talk about some of the exercises that can help correct some of the underlying causes of crooked teeth. Hello, this is Dr. Dhillon. Before we get into the video, I just wanted to give a big thank you to all our supporters, all of you who have subscribed to our channel. We are really humbled by all of your support, and we really enjoy educating so many people around the world. Our recent video on how to straighten your teeth naturally at home, link somewhere, had a lot of requests on some of the exercises we teach our patients. We can take literally hours explaining every underlying cause and all the different exercises associated that would be responsible for correcting it. But to just simplify it for the purposes of this video, we're going to go over 2 simple exercises per 3 different underlying causes. In the next few months, we can do a deeper dive into each of these underlying causes of crooked teeth based on your feedback and your requests. So one quick caveat before we go deeper into the exercises. If you search YouTube, you're probably going to see a variety of different exercises being prescribed. And that's because when it comes to myofunctional therapy, there's a variety of different schools of thought. Not to say any one is wrong or right. They all have valid points, and many of these exercises might even overlap. Could be kind of confusing as a patient who's looking at it from a perspective of what should I do. Now, the particular school of thought or camp that I like to follow is by MyoBrace, and they came up with a series of exercises that they believe works well. I've seen them work well in my practice with many of my patients. And those are the exercises I'm going to kind of just briefly go over today. One of the first underlying causes of crooked teeth is mouth breathing.
And I think that breathing has to be considered along with diet and exercise as a pillar of health. Because even if you eat keto, vegan, paleo, whatever, even if you exercise all the time, if you're not breathing right, you're never really going to be healthy.
The 2 exercises I recommend are 1, nose clearing, which has been made popular by Patrick McKeown. Nose clearing is honestly, it's a pretty funny looking exercise. It involves holding your nose and shaking your head left and right for a number of seconds. Now, when you do this, you're holding your breath at the same time, and it is creating nitric oxide gas in your nose, which is like a natural decongestant. And it just makes it so when you release your nose and you take a deep breath through your nose, and it just helps to clear your nose more naturally. The more comfortable and more you can clear your nose and more comfortable you get breathing through your nose, obviously the less reliant you will be on mouth breathing. The second breathing exercise is to promote the fact that we should be breathing through our diaphragms and not through our chest, and we should be breathing deeper but slower breaths. Studies have been found to be healthier way of breathing. So that involves lying down on the ground and putting something on your belly and just carefully timing yourself to breathe in and out and being able to see that go up and down, and timing yourself so that you can breathe more slowly but more deeply through the diaphragm and not through your chest. The second underlying cause of crooked teeth is poor tongue posture. The 2 exercises that I'm going to mention for this video. 1 is to rest your tongue against the roof of your mouth. Basically you want to like suction cup it against the roof of your mouth and kind of and open your mouth, and then try to keep your tongue as still as possible. That helps to develop the tongue strength so the tongue gets more used to resting in that position. The second exercise is, as MyoBrace describes, is called a surfboard tongue. You're sticking your tongue out as far as you can, holding it as still as you possibly can and as straight as you can, literally like a surfboard sticking out of your mouth. The third underlying problem for crooked teeth is an incorrect swallow. The first exercise that I prescribe for that is an exercise where we'll have our patients keep their lips slightly apart and literally drink 1 glass of water where they take every sip with their lips slightly apart so that their lips, working to deactivate their facial muscles so that their lips and their cheeks hopefully won't squeeze in and constrict when they swallow. And the second exercise for this habit correction is when, after you've mastered the first one, then the second one will be the next step where your lips are closed when you swallow, but this time you look in a mirror as you're swallowing to make sure your facial muscles are not constricting when you swallow. So like I've said before, this is a very complex field with every patient being a little bit different in terms of their particular problems that they have. So it's really important to get assessed by an expert properly, and then they can kind of really prescribe the exercises that would be best for you. So really important that you get consultations and be able to find someone who can be able to diagnose you more accurately. Over the next few months, we hope to go deeper into some of those subject matters, based on everyone's feedback. So please subscribe and like this video so we be able to provide you even with further content. Thank you very much.